Welcome to Medulla channel. Our topic for today is scalp. The number one objective that we're going to study in scalp is your extent of scalp. Alright, so extent of scalp starts from the superciliary arch, goes across the superior temporal line all the way to the superior nuchal line. So this is all you have to know about the extent of scalp. Then we come to the layers of the scalp. Mnemonic is the word itself, that is SCALP. Skin, connective tissue, aponeurotic layer, loose areolar tissue, pericranial. Now, you have to note down 3 MCQs. The common formation of sebaceous cyst is in your skin layer. Now, why? Because skin has hair follicles, and all hair follicles have sebaceous glands. Therefore, sebaceous cyst formation is in the skin itself. Then you have connective tissue. Connective tissue has veins and arteries. Now, this layer, the most important vein that traverses all the way up to the superior sagittal sinus, is your emissary veins. Just note this down. It's very, very important. Then aponeurotic layer. The second thing they can ask you, that in which uh, muscle is present in this particular layer. There is occipitofrontalis muscle. Then you have loose areolar tissue. Loose areolar tissue is also called as a danger area of scalp. Very important MCQ. Now, why is it called? We will come that in some time, but just have some patience for now. Then we have pericranium, and last we have bone of cranial vault. Now, the veins supplying the bone of cranial vault are known as your diploic veins. These are valveless veins. Great. Now we come to the third objective of our video, that is nerve supply. Now, there's a small trick that you have to note over here. I usually remember it in this way. You have to just remember supratrochlear, supraorbital, occipital, because these three things will be repeated in the arterial supply of skull and the venous supply of the skull. So remember these three terms very well. In nerve supply, occipital is divided into three: lesser occipital, greater occipital, and third occipital. Alright. Now the other things that you have to note down is your zygomaticotemporal, auricotemporal, and greater auricle. These three things, just learn it. Alright. Then you have your arterial and venous supply. Again, the same trick: supratrochlear, supraorbital, your occipital. Over your venous supply also same: supratrochlear, supraorbital, occipital. And just remember the other two, that is superficial temporal artery, posterior auricular artery. Over here, the superficial temporal vein and posterior auricular vein. Great. Now we come to the clinical cases. Now, as I said, the fourth layer is called as your danger area. Now, why? Now, just uh, have your attention towards this diagram. If you can see these first three layers, that is SCA, skin, cutaneous tissue, and an aponeuristic layer. These three things cannot be separated during dissection. Therefore, they're also called as surgical layer of scalp. Note this down. They cannot be separated, hence called as surgical layer of scalp, or also called as scalp proper. Alright. Now, the layer underneath that is your um, loose areolar tissue, in which blood, pus, and fluid accumulation takes place during any injury to the skull. Alright, so whenever there is any particular fight or any violent sport and a person gets hurt, so the uh, the blood, the fluid, the pus will get accumulated in the fourth layer, and once that is completely full, it will travel towards the eyelid, the eye, around the eye orbit, and it will cause a condition called as your black eye, which you can see over here very clearly.